Hello, boys and girls of Year 9. Today we'll be talking about radioisotopes, and the specific one that will be spoken about is phosphorus 32. First of all, before we start talking about phosphorus 32, let's get to know what a radioisotope is. A radioisotope is an atom where the nucleus decays, giving off energy and particles. This is known as an unstable atom. When the decay leads to change in the number of protons, the element changes and becomes a different one. Phosphorus 32 has 15 protons and 17 neutrons. Its atomic number is 15 and its atomic weight is 30.97. The physical half-life of phosphorus 32 is 14.29 and the biological half-life is 257 days. The symbol for phosphorus is capital P. If we were talking about the way the protons, neutrons and electrons are placed on the atomic diagram, the neutrons and protons will be placed in the nucleus, and there will be 2 electrons on the first shell, 8 on the next shell, then 5 on the outer shell. Phosphorus 32 emits beta particles. Its penetrating power is medium and can penetrate through skin or paper. It is absorbed by a layer of aluminium, wood or plastic. Phosphorus 32 is used in different areas of the medicine industry. It is used for the treatment of polycythemia vera, which is excess red blood cells. The other treatment that it's used for is chronic myelocytic leukemia, chronic lymphocytic leukemia, certain ovarian and prostate cancers, and palliation of metastatic skeletal disease. It is also used in different areas of medicine and science, and that is biochemistry, molecular biology, where it can trace phosphorylated molecules, for example, radioactively labeling DNA. Phosphorus is considered to be the second most perfused mineral in the human body. It provides the strength to the bones and teeth. It helps us to perform essential activities to different body parts like the brain, heart, kidney, and blood. It also can be used when killing tumor cells. Radiation therapy is a mix of high-energy X-rays to damage tumor cells. The drug phosphorus 32 helps the tumor cells become more sensitive to the radiotherapy. The combination of radiotherapy, chemotherapy, and phosphorus 32 kills more tumor cells. There can be risks and complications included in phosphorus 32, whether they are common, low, or rare risks. One of the most common risks of phosphorus 32 therapies is that it falls in the red blood cells from the exposure of radiation. This could damage blood cells that aren't damaged, but this cannot be prevented. Less common risks mean that there is a risk of them happening, but at a low level. Some of these less common risks and complications include: it can fall in your blood cells from the radiation and is enough to cause anemia. If this does happen, it may resolve over time. It can fall in your white blood cells from the radiation exposure and could increase the risk of an infection. If this does happen, you may require antibiotics. It can fall in your blood platelets, which could be enough to increase the risk of bleeding. If this does happen, it may require treatment. Even though phosphorus 32 can be used to treat leukemia, the therapy may or could further increase the risk of developing bone marrow disorders or increase your condition that you currently have, which means that the treatment wasn't successful. There is a rare risk in every therapy or treatment, and they need to be put out there for patients to read and understand in case it does happen. Some of these rare risks that could come up in the procedure of phosphorus 32 are: there could be minor pains, bruising, and or an infection from IV cannula. Intravenous cannulation can be defined as the placement of a device into a vein to allow access to the venomous system. It can be used to deliver drugs and fluids to the patient. This may have to be treated with antibiotics. It may fall into any of the blood cells due to exposure from radiation. If this occurs, a blood production transfusion may need to occur. Injected phosphorus 32 has a chance of leaking outside the vein, under the skin, and inside the fat tissue. This can cause radiation damage to the tissue and may require treatment. In the rarest of cases, further surgery will be needed if the skin starts to break down. The rarest case of the whole therapy is death, and is a very small possibility, but needs to be addressed for the patient to know. Phosphorus 32 exceeds the risks involved. As was mentioned earlier, phosphorus is considered to be the second most perfused mineral in the body, and essential to many body parts. Phosphorus 32 as a drug and a type of radiotherapy can kill tumor cells in the body, and the risk to benefits is very minimal. All the risks mentioned have very low chance of happening. They were listed as low or rare, which means that your odds if you are going to go through with the procedure of using phosphorus 32 are pretty good. There is nothing to lose, and the outcome could be good in the end if it does kill your tumor cells or any other disease that you have. Some interesting facts about phosphorus are: it is an essential element of your living system and can be found in your bones, cell cytoplasm. Some interesting facts about phosphorus are: it is an essential element of your living system and can be found in your bones, cell cytoplasm, and nervous tissue. Phosphorus 32 is painless and no anesthetic is required. So there is a bit of information on phosphorus 32 and radioisotopes. I hope I have gave you an insight into how phosphorus works and what it's used for. Thank you for listening.